Welcome back to APIC Science into Practice. I'm Nicki, joined as always by my co-host Jess. Jess, I do have a joke to start us off. Why did the infection preventionist bring a ladder to work?
Oh boy, why?
Because their career ladder didn't exist, so they had to make their own.
No. Well, unfortunately, that is painfully accurate and the perfect lead-in, because today we're talking about infection preventionists, why they leave, why they stay, and how we can build the supports they need.
Yes, and we have not one, but two fantastic guests. First, Dr. Sara Reese, PhD, MPH, CSE, FAPIC. Sara is the Director of Research for APIC's Center for Research, Practice, and Innovation, and before that, she led infection prevention at Intermountain Health. She managed COVID-19 response at Swedish Medical Center, worked with Denver Health and the Colorado Department of Public Health, and mentored countless MPH students. She's published widely, presented nationally, and has been a leading voice on recruitment and retention challenges in our field. And when she's not fighting infections, she is trying to keep up with her 14 and 10-year-old boys on snowboards and mountain bikes.
Oh my goodness. And alongside her, we're thrilled to welcome Albert Shackelford. Albert is an active duty sailor and recent MPH graduate from the University of Colorado, now preparing to transition into full-time public health work. His passions include community health, systems management research, and mental health and well-being. So Sara brings us years of IP leadership, and Albert brings the fresh perspective of someone newly entering the field. I love this balance. We've got wisdom and we've got fresh energy.
Oh, guys, we're so excited to have you guys here. Of course, this article led to my very painful career ladder joke in the beginning, but it's a really, really important topic. So Albert, Sara, thank you so much for being here. And I'm going to direct my first question to Sara at first, okay? So let's start with the tough side. Why do infection preventionists leave their jobs? Your qualitative study found themes like workload, lack of recognition, limited professional growth, leadership issues, and of course, the COVID effect.
Yeah, so this was a fun project with the qualitative side of things and the focus groups. We had a lot of really tough conversations, really interesting conversations about why IPs leave their jobs and why IPs will stay in their jobs. And for those that were what we called the transitional IPs or the former IPs, where they had left an IP job for another IP job or left the field entirely, it was almost like a therapy session for them. They really wanted to talk about how much they loved the field, but it just wasn't the right fit for whatever reason in certain organizations. They loved their previous workplace, but there was factors that were just difficult to overcome to allow them to stay in that role. And really, you can't ignore COVID. It did really drive a lot of people away from their jobs and out of the field entirely. But there's a lot of other areas that really came out as these major themes. So one of the biggest areas that resulted in attrition was the lack of career development opportunities. Your ladder joke, while it was a little bit corny, it definitely hit the nail on the head, though.
Yeah,
IPs can be in a role and really realize that the only way up is to take a different job. There's just not a lot of opportunities within their specific role at that specific organization. And this really shouldn't be the case for IPs these days, because APIC just released the IP career pathway. It outlines different career levels for IPs as they progress through their careers. There's a lot of opportunities for IPs to grow as they grow professionally in this career. And then secondly, really interesting, and we'll talk about this throughout this podcast, is the importance of a flexible schedule or work from home days. It goes so far for an IP. Our field of infection prevention is evolving tremendously, and IPs can have that flexible schedule. They can work from home a little bit, and then they can come into the hospital and still be able to focus solely on preventing infections. And there's just a lot of organizations that still have that mentality that IPs need to be in-house all the time. And sadly, they're losing IPs because of it. We can really do this hybrid model. It works. And otherwise, IPs are going to be leaving to try and find that perfect fit where they can have that flexible schedule.
Yeah, and you know where else IPs can work is on vacation, and I bet everyone who is an IP listening to this knows that.
We know the resources that it takes to onboard new infection preventionists. And also, when you lose those seasoned infection preventionists, what a loss that is to your organization. So, to see them leave solely because they're unable to grow professionally is so sad, because it is such a loss. And, you know, having those years of experience and the respect that they've gained, working in your organization is just, it's sort of priceless, honestly. But this is a good lead in for Albert. So, Albert, you're new to the field. When you hear about burnout and lack of support and people leaving, what does that feel like to you as you're considering stepping into this world? Hopefully, we're not being a big bummer.
No, I don't. I think it's important. Firstly, I would like to thank all the healthcare workers and IPs for the work that they do. It's super essential to making the world go round. And doing this study, I was really struck by how passionate people were about the IP field, and especially when I think about the open-ended questions and the focus groups. It was powerful. I mean, you do the research about how tough healthcare can be, and you look at the numbers, but to hear and see the stories behind the data is probably the thing that has stuck with me the most. To your question, when I consider these issues, I really try to pay attention to the why of it all. Every system and every hospital is going to have different barriers affecting the support that practitioners receive. But as a part of this research, I'm very aware of the importance of finding a role that is not only in line with my interests, but also supportive of my professional development, and while obviously having reasonable work demands. Something else that comes to mind when I consider these issues is the question, how can I help? What struck me in this research is how some of the issues that practitioners face stem from preventable systems issues. Things like misalignment of priorities, communication gaps, rigid schedules, limited growth. And as someone entering the field, I see that as both a challenge and an opportunity. We can design better systems, we can improve cultures, and these things can help retain talent. And I want to be a part of that shift. And I think that moving forward, the structure of support of healthcare workers is something I will always look to improve, whether it be research, policy advocacy, or maybe some other form of outreach or collaboration.
Albert, the field is incredibly lucky that you are here. And, you talked about focus groups earlier. So you guys talked with tenured IPs, transitional IPs, former IPs, and leaders. Did those groups see attrition differently?
Yeah, they certainly the focus of the focus groups per se were definitely different based on which group I was talking to. The tenured IPs, the ones that had been in their current organizations for more than 5 years, they had a lot of really nice things to say about the organization. They were more likely to have that flexible schedule, the professional development and career opportunities, and the organizational support for infection prevention. Unfortunately, the former IPs and transitional IPs, the ones that either left the field or left a one IP job for another one in the recent past, they were pretty negative towards their previous organizations on those same topics. And so it was a very divisive sort of dynamic between those different groups. IP leaders, though, they were in a really tough spot. We had a lot of IP corporate directors, so they oversaw, multiple hospitals with a lot of IPs under them, and they're just in a tough spot. They're kind of in the middle of trying to really want to keep those IPs, and they have those challenges with attrition, but they're also really confined to those organizational leadership and the offerings for IPs. If you have an HR department that's not willing to support a career ladder, or you have executive staff that's not willing to offer that flexible schedule or work from home options, the IPs are going to leave, and the leaders really they can advocate all they want, but it's really going to come down to what is that organization going to offer.
Yeah, and I think it's important to note too, trying to maintain your talent, and how we have a lot of big organizations that do a lot of restructuring periodically, and you can lose a lot of talent through that restructuring. I think we need to be careful with that.
Yeah, so we're never going to be able to describe, I don't think we'll be able to ever describe the impact of COVID on our field. I mean, everybody who is an infection preventionist during this time has their own stories of trauma and triumph. It was a whole thing that hopefully many of us will never have to go through again. But so many IPs, honestly, they went to early retirement or left the field entirely after COVID. It was just too much. Needed to do something differently. And a lot of the IPs, most of them described the exhaustion and the stress, of course, but it was really interesting and even inspiring. Some found it just invigorating and loved being in the limelight. I had one IP and I had to tell her I was going to steal this quote from her. She basically equated it to, we were the pitcher on the bench and then we got, promoted to pitching Game 7 of the World Series and we are in the limelight. Everybody's watching us, right? And it was just so great. But then there's the fallout of following Game 7, you win World Series, and then, well, you go being sent back to the bench. And it's really, a lot of IPs are experiencing this now. The glory days are over, and we're kind of going back to, we were in the moment where everyone's hyper focused on infection prevention and really listening to everything we had to say. And now we're just kind of relegated, some, not all, relegated back to hand hygiene audits and being data collectors. And it's kind of the downfall of following, being so popular. So I think that level of disappointment and just really going back to where we came from, that lack of organizational engagement is, really difficult to overcome after such a kind of heightened attention for so long.
And I knew a few IPs that actually started IP infection prevention right before COVID, around 2019. So that's gonna scare a lot of people away. Yeah. But we've talked about so much.
This is not how it normally is.
Right. Exactly. Yeah. We've talked about why IPs leave. Let's talk about why IPs stay. So, on the flip side, your service gave us the top 10 retention factors. They're things like flexible schedules, supportive leadership, organizational commitment. So, Albert, as someone looking for your first full-time public health role, if an organization said, we'll give you flexibility and invest in your professional growth, would that make you more likely to sign on and stay?
Yes, absolutely. It would make a huge difference. And to me, an organization that offers flexibility and professional growth is showing you that they understand the human side of public health work. When an organization offers these things, they are investing in individuals, in their people. They are showing they value me, they value the work I bring. And that also tells me that they're thinking long-term, not just about filling a role, but building a team. Flexibility also shows trust and allows individuals greater freedom to manage their time and responsibilities. I personally work better when what matters most is results, not necessarily, are you here? Do I see your face? More, this is a project, I need it done. Here's the time I need it to be done, but get it done when you feel like it. So yes, if an organization offered that kind of support, I'd be far more likely to sign on and stay. And furthermore, honestly, more likely to step up in crunch time or crisis mode. If, at some point they need someone to work extra hours or take on extra projects, I might feel the need to pay it back. They look out for me, let me look out for the company. So I think it also builds a certain kind of loyalty to your organization as well.
Yes, and I really like that answer because I think it really just highlights the importance of that. I'm going to tell on Albert here. He's in Spain right now. So, really, if we have a computer, I can do this job. We want to definitely be in the hospital and rounding and doing all that, but we can also do a lot of it from afar. So really, I guess what I'm saying is I need to be in Spain right now doing this job. On the coast of Spain. Okay, so Sara, your multivariate model highlighted 3 especially strong predictors: flexible schedules, organizational support for APIC participation, and leaders who create protocols for disengaging from work. Can you unpack why those matter so much?
Yeah, those are definitely considered highly correlated with IP retention and why people would stay in a job. As we talked about already, flexible schedule is a super important retention tactic. The IPs can be effective working either a flexible schedule or work from home options. And as we said, like if you can spend that dedicated desk time when you're not in the hospital, when you go into the hospital, you have just that great opportunity to really be hyper focused on what, rounding and educating and talking and doing all the things that we need to do in the hospital. It's a really nice balance. Organizational support for both APIC participation and just support in general for infection preventionists was a really big one that came out both in the focus groups and the survey. IPs are really only as effective as their organizational support. They're not going to get very far if the organization from top down doesn't support what they're doing. If their executive leadership is on board with their initiatives, there's really no stopping the good, solid, effective IP team that can, nothing's going to get in their way. And I'm sure many of us have worked for that type of leadership where it's just they are fully supportive of everything we're doing, and we can do so much. But we need to feel the support from top down. It's got to come from the top, and it's got to be felt throughout the organization. As for protocols to disengage from work is really one that's associated with work-life balance. IPs can, it's IPs that can be able to walk away and be on a vacation or be able to enjoy their weekend. They're going to be more likely to stay in an organization. They need to have those protocols that can, allow them to do that. So they're not always tied to their phone and feeling that there's an emergency around the corner. And those IPs that are constantly on call, they're definitely much more likely to find a new place of employment, unfortunately, but understandably.
I noticed generational differences in your data. Gen X more likely to stay, millennials more likely to leave. Do you think that's about career stage or deeper cultural shifts in how we view work?
I honestly think it's a little bit of both. We're actually, sneak peek, we're working on another paper that's really going to dive into the number of years of experience that IPs are into their career and how it ties to retention. And so I'm not going to give away the data there. You'll have to wait for it to be published, but it's coming soon, hopefully. But, historically, the millennial generation has been known to move jobs more often than the Gen X's. And I think infection prevention is no different. But it also, I think, definitely comes down to where IPs are in the career stage more than anything. We've talked about how that lack of professional development is going to lead to attrition. And Gen X's have probably been in the IP role a little bit longer than millennials, given that we're older. I'm a Gen X myself. But so the millennials are probably at the point in their career where they do need more, and they do need to seek that out and find the organization that's going to give them more. And they may not be getting it in their current roles. So whereas Gen Xers are more settled and at this point in their careers and, probably less likely to jump jobs, you would hypothesize at least.
Yeah,
Yeah. It'll be really interesting to see what happens in the future with the Gen Zers, actually, as well.
Oh, yeah, for sure. Absolutely.
Yeah.
I agree on that. I think in general, younger generations are more emboldened in how they view themselves and value themselves professionally. And I think that some of the younger participants in our study actually mentioned this dynamic of, trying to find jobs that align more with their purpose and well-being over things like stability or the prestige of a job. And I don't necessarily think it's a bad thing, but I do think it'll be interesting to continue to observe how organizations support their workforce moving forward, because obviously organizations invest a lot of resources into individuals through training and education, and they're going to need to see a return on that investment. And if people are constantly shifting jobs with the younger generations, then who knows how support is going to end up being shown to the new workforce.
I do think that's an interesting look, because whenever I have done any sort of orientation or we take classes about adult education and how to teach adult learners, we talk about generational differences. And every generation is different. I think it gets frustrating sometimes for the organization to try and figure out how to meet each different generation where they are. However, that's what you have to do for retainment. So I think it's an interesting look. And I think one big insight that I took from this is that retention is not just about the IP, it's about the system around them. It's about the recognition, the respect, the leadership ripple outward. And a lot of that can be generationally defined.
Yeah, and second, flexibility isn't just a perk. It sounds like it's also a predictor. If you want IPs to stay, you have to let them be humans with lives outside of the hospital. Otherwise, they may be gone.
Yeah, I totally agree with that. And I think to start wrapping up, I would love, Sara, if you could give one piece of advice to a hospital CEO that's listening right now who's worried about losing their infection preventionist, what would it be?
Well, IPs are a special kind of person, and once you find a good one, try to keep them. We are hard to find and definitely difficult to train. So trying to get that good one, the unicorn, you want to keep your unicorns. And so IPs don't need a whole lot to keep them happy. Give them a flexible schedule or some work from home options, and provide them with professional growth opportunities, similar to other professions that we find in healthcare. And that organizational support, it's going to go so far if that top level CEO is going to support the IPs, that trickles down and definitely keeps IPs much happier.
And Albert, if you could give one piece of advice to your fellow new grads or early career public health folks, what would help them thrive and not burn out?
Yes, I would just say breathe and remember why you started this journey. Public health obviously can be overwhelming at times, especially early in your career, but staying connected to your purpose will help you stay grounded. If you visit your motivations regularly, you might even find yourself embracing the grind and embracing the challenges and the nonstop nature of whatever the work is that you're doing. And I know it sounds cliche, but the breathing part really matters. I think finding moments throughout the day or the week to pause, reflect, and put things into perspective is essential. It's not just about peace of mind. It's about recharging your batteries so you can keep showing up ready for the next challenge.
Yes, definitely
I love
breathe.
it. I've had to do that a lot during my career, when we get certain situations, like you said, you ground yourself. Just remember to stop and ground yourself. And I just really want to thank you guys for this conversation. It has been such a gift. Thank you, Sara and Albert, for bringing both depth and fresh perspective to this issue, because it's really important.
And to our listeners, remember, if you want to keep your IP happy, skip the pizza party and maybe just let them work from home on Friday.
Amen to that. So thank you, everybody, for turning into APIC Science into Practice. We'll see you next time. Thank you for joining us today. We are Nicki Shore and Jessie Swain, and this is the American Journal of Infection Control podcast, Science into Practice. Thanks for listening and doing your part to prevent infection, because remember, infection prevention is everybody's business.
APIC Science into Practice is created by the Association for Professionals in Infection Control and Epidemiology with input from the APIC Center of Research, Practice, and Innovation, and Jean Brandt at APIC and APIC staff, Rebecca Bartles, Ria Gupta, and Bobby Gulshan. We work in partnership with Human Factor and audio techs Blake Althan and Carolyn Schneer. To hear other APIC episodes and to access information about this podcast and the field of infection prevention and control, go to our website, ajicscienceintopractice.org. That's AJIC scienceintopractice.org.